Thank you, Mr. Chairman. Mr. Secretary, thank you for being here. I want to follow up on a question that was asked earlier. Have you been asked to weigh in, not in terms of reviewing bill text? I understand you haven't seen bill text, but have you been asked to weigh in on the policy aspects of the Senate repeal bill?
As I said, my staff has been engaged in conversations with staff. I've had conversations with members of the Senate about what kinds of things we believe need to be done to make certain that individuals have access to the highest quality care
And what's your understanding of the status of the bill? Just process-wise, where we are in the because, you know, you may have some insight that Democrats don't have. As you know, there is a 13-person group of men, not the HELP committee, not the appropriations subcommittee on labor HHS, not the leadership, just 13 men literally meeting in secret, talking about what to do with around 1/6 of the economy. So are you participating in those conversations personally, either sort of serially, consecutive conversations, informally over breakfast and coffee? What is your level of participation in those conversations?
My knowledge about those conversations specifically is what your knowledge is, and that is what you read in the newspaper when you get up in the morning. I understand that the leader's goal is to have a bill come through the Senate by the 4th of July or shortly thereafter.
I'm sorry, but the question is, are you talking to any of those members in that 13-person group of men?
Well, I couldn't tell you who the 13 people are, but I talk to senators all the time about health care issues, and many of them have questions about what we think the appropriate, what an appropriate health policy would be to solve the incredible challenges that exist out there, especially in the individual and small group market.
Right, you're a physician, you're the secretary, you're the former chair of the budget committee, you've worked on a bipartisan basis, so I'm just going to ask you a couple of questions related to your personal opinion around lawmaking. Do you think that that 13-person group would benefit from the perspective of a woman?
As I said to another question that was asked, as a member of the Article 2 branch of the government, I will leave the Article 1 branch functioning to the Article 1 branch.
You can't answer the question of whether you think a health care discussion would benefit from having a woman involved or not?
As I say, this is an internal issue for the legislative branch, for the Senate of the United States, and it's not my role to engage in the processes, the tactics that go on here in the legislative branch.
How many days do you think is a reasonable number of either legislative days or calendar days for you and your staff to be able to review a bill to determine what your position is on the legislation in terms of the department? How many days do you think you need for a bill of this magnitude to be able to kind of metabolize it and opine on it?
Well, if I take my secretary hat off and put on my congressional hat that I had on for 12 years, I can tell you how many days I had for the ACA, and that was about 2.
How many days do you think you needed?
And that was not enough for a 2,500-page bill.
How many days do you think is reasonable for the department to be able to come to a conclusion about any piece of legislation?
For the department to come to a conclusion?
Yeah, for the department.
Well, the department is engaged, and from a technical assistance standpoint, it's not the department's role.
On an ongoing basis, right?
Sure, on all sorts of issues.
Right, so I guess the question becomes, if we were to present, say the Democrats were in charge and we were going to present you with a bill that you hadn't read, that you had only heard about through sort of open source reporting, how many days do you think you would need to process that bill and to come to a policy conclusion about it?
Well, I look forward to a bill coming from the Democrats to suggest how we improve the health care system.
We're not going back and forth sort of rhetorically. I'm just asking you how many days you think.
It would vary on what the topic was and how complicated the issue was.
Right, but we're talking about this issue. So it is complicated. You're very intimately familiar with how complicated it is. You're in charge of the department. How many days do you think you need to process a bill?
That's a hypothetical, and it's a not answerable question.
Thank you.